Innovation often hides behind polished decks and carefully curated visuals. This session strips that away. No slides, no rehearsed graphics, only ideas. Each innovator here represents a frontier: space navigation, human augmentation, AI chip design, nanoengineering, and leadership psychology in an automated world. The absence of slides is intentional. It forces clarity, it demands substance. So, this format invites thinkers to articulate breakthrough ideas without visual scaffolding. It reflects the essence of innovation, distilled thought, not decoration. It also challenges the audience to engage actively rather than passively consume information. So we are joined by Jason Held, CEO, Sabre Astronautics, Kunal Dalal, Agentic Leadership Strategist, Deblina Sarkar, MIT Professor, Shelley Henry, CEO and co-founder, Moores Lab AI, and Neil Harbison, Cyborg Artist. So I welcome all the panelists here. First, I would like the speakers to introduce themselves to the audience so that they can have the questions and ready for you.
Sure. Hello, everyone. My name is Deblina Sarkar. I'm an associate professor at MIT. I work at the intersection of nanoelectronics and biotechnology, basically developing brain implants for tracking and helping people with brain diseases and mental illnesses. Thank you very much.
Hello, everybody. Dr. Jason Held, CEO of a company called Sabre Astronautics, based in Australia and the US. And what we do is we fly satellites for a living, and we produce space operations software, space domain awareness capabilities, monitoring tens of thousands of objects in space every day. Customers including US Space Force and the Mission Control Center out of the Australian Space Agency. Thank you.
I'm Shelley Henry. I'm a founder and CEO of a company in the US called Moores Lab AI. What we do is we are building a platform that will enable people to build semiconductor chips very fast and very cheaply. So that's our mission goal. With the onset of that, any small company should be able to build chips. A lot of companies like that will come up in India. That's our goal and vision.
Hi, my name is Kunal Dalal. I am agentic leadership strategist. My company is called superleaders.io, and I help corporate leaders, business leaders, and education leaders sort of figure out organizationally and operationally how to rethink their organizations in an agentic world.
I'm Neil Harbison, and I'm a cyborg artist. I created this antenna that is implanted in my head that allows me to extend my perception of reality beyond the human limits. It allows me to sense from infrared to ultraviolet. I'm also the co-founder of the Cyborg Foundation, an organization where we help people become cyborgs. So basically merge physically with technology.
Thank you, speakers. So now the audience part comes. You need to ask the questions to the speakers, the innovators, I prefer to say. Console, please provide the mic here.
Hello, my question is from ma'am. I am a founder of Syndex. We are basically building a graph neural network to map the entire brain network of a person, so that we could provide better quantitative psychiatric help to patients rather than subjective checklists like DSM-5. So my question is primarily, how do I approach this and how do I get to partner or validate this idea? Because we have been building on data sets and we have built up an MVP based on data sets that are publicly available or through some agreements. How should I go about it, and what kind of help should I try to get?
I think the major challenge right now in neurotechnology is we have like 100 billion neurons in our brain, but right now the technologies we are using for recording from the brain itself is very archaic. We only can record from a few hundreds of neurons at a time. The data itself is not enough. And that is one of the reasons like 3 billion people around the world suffer from different brain diseases, but we really do not have any treatment for most of them. None of the brain diseases right now have any cure. So right now, I think the technologies you are building would be limited by the data that you'll get from recording technologies that are there. So I would say the best way for you is to look into new technologies that are used for having, like basically they can record from brain most of the neurons and get the data.
Basically, we've been using electroencephalograms that are used by neurologists and simultaneous fMRI plus EEG to map the entire brain so that the sensitivity of this increases and we can detect certain biomarkers that are relevant to psychiatric health like mental health disorders, depression, ADHD. We have calculated certain biomarkers, frontal alpha asymmetry that gets an insight inside your entire brain and what kind of drugs work with you or RTMS therapy would work. That is what we are trying to do.
Yes, but yeah, I think that is great. I think it will still help a lot of patients. But as you know, like fMRI and EEG, they have a major problem with the resolution. You can get with fMRI, you can record from 1 million neurons at a time, where what we would ideally like to go is a single neuron resolution. But with AI technologies and debugging and kind of getting more information out of which you can record from a whole brain, I think those, the softwares you're building will still help, but I still think that the resolution still remains a limitation until unless we have a technology where you can record from each and every neuron in the brain at a large scale of the brain. Would still be limited by the technology rather than, understanding from what data we can get with existing technologies.
So I know where you're coming from a very different industry, because on one hand there's a technical discussion, but the other hand is kind of like you say, how do I break through the barrier of research and convert that research into commercial use? So if you're talking to hospitals, they're not going to buy your product. They have a process. If you're trying to sell it to the military, they're not going to buy your product. They have a process. My company's been around 18 years. I went through exactly what you're going through now. So I feel you. What you really need to do is not a technical problem. It's a human problem. You get to know people, understand their issues, exactly as you just did here. This is actually a perfect example of customer discovery. And you need to build the trust with individuals. There are innovation programs that you tie into to get past that kind of, you need your first research and development contract is what you really need. And it's not about you needing it to prove that you could do what you're already doing. What you're actually building is a corporate resume. Just like you have a resume as a human being, you're getting a resume for your company as well. And that's my recommendation is you start there, one small contract at a time, even if it's not the global lab. We used to do research for free because universities don't want to pay money to startups. They really don't. In fact, you're a bit of a competitor in a way to some universities if you have something that competes with the researchers in that group. But build it because it's a relationship building exercise. Then when you do go for the grant, you're going together. You're hunting together with the university, with the academic to solve some of these problems at the same time. And that's how you build it from scratch, how you build that seed. Thanks.
Thank you for that insight. I've been in talks with a lot of psychiatrists in India, and one metric I got to know was that there are 9,000 psychiatrists in India and about 197 million people that are suffering from mental health problems. So I talked to about 20 psychiatrists, and one of them agreed to do like a study inside their own government medical hospital in Kannauj, and hopefully we are able to conduct that study and validate whatever we are building. Good luck. Thank you so much.
Hi. So I'm Yash Goel. I'm with the Times Network. I would love to have inputs from everyone on the panel. If you go back a decade ago, or perhaps 5 years ago, AI was perhaps for the general public a thing of the future, but it came really quick. You all as innovators, I really want to know, cutting through the clutter of the artificial intelligence, is there any other innovation perhaps we should be aware of, which will perhaps take the world by surprise in the next 5 or 10 years?
Absolutely. One thing that definitely comes to mind is the quantum computing that has been in the nascent stage for quite some time, same as artificial intelligence has been around for quite some time, but there was a threshold beyond which it became ubiquitous and everyone started using that. Quantum computing is at that point. That could be one of the next leap in technology that's coming out.
I think maybe the next one will be AS, so artificial senses, not artificial intelligence. I think we will start exploring how we can sense more. Now that intelligence is available for all of us, we have it in our pockets, maybe we'll start focusing on perceiving more and sensing more and adding new senses so that we can start experiencing nature in a stronger and more profound way. And technology can give us new senses. So I think that's one of the branches of technology that still hasn't exploded.
And I think our current sort of generative AI, LLMs, all of that, I think they are actually going to function as a catalyst for things that we are not even ready for. And so, and the timeline of some of those things could be as quick as 6 months, a year, 2 years. We don't know. And especially if you start to put quantum computing in the mix, I mean, who knows, right? But I think we're really talking about world-changing things potentially, right? Both on the upside and, unfortunately, potentially on the downside as well. But I think right now, it's really important for us to live very presently. And the more we sort of keep thinking future, 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 I think we abdicate a lot of responsibility for what we have to do right now, because we have a lot of power right now to sort of guide what the next kind of exponential, logarithmic kind of advances might be. But if we already have an idea of what that is before we explore in the present, then that's gonna kind of hold us back.
I think going beyond artificial intelligence was very exciting is augmenting human intelligence itself. So one of the things we are working is seamless integration of electronic devices into the brain that could be used for human augmentation, not through neuromodulation, but also by increasing the number of neurons that you have. So we are limited by the biological neurons of 100 billion, but you could have 100 trillions of neurons, and this could be done through synthetic artificial neurons, like electronic devices which can be seamlessly integrated into the brain. They can connect with biological neurons, they can connect with each other to seamlessly increase human intelligence. So this is beyond what artificial intelligence can do.
Sure. Within my own domain, we're seeing on-orbit manufacturing. So the conditions in microgravity, you get rid of gravity, what you have left is surface tension. You could create near-perfect crystallization. So that leads to silicon chips that are 10 to 100 times faster in processing, fiber optics, super drugs, manufacturing of organs on orbit. It sounds a bit macabre, I know, but that's something that we expect to see happening very, very soon, like within 5 to 10 years. Johnson & Johnson, for example, spends hundreds of millions of dollars on drug research on the International Space Station today, and they're not publishing the results. They don't want you to know what they're making, but you could see changes in the drug industry certainly leveraging that. Thanks.
Sir, as you talked about quantum computing, I am a biotechnology student. I specialize in drug discovery. And there's this big problem in drug discovery that there are trillions of conformations that proteins live in, and there are millions and millions of conformations that ligands live in. And when you combine that, you get a sort of in silico analysis that normal companies use. But the problem with quantum computing that I feel right now is that the hardware is not the problem. IBM's been making it for a long time. The problem is that what I have read is that I read like 2 algorithms, Shaw's and Grover's algorithm that run on those quantum computers. The problem is on the software side. There are not enough algorithms that break into these real life problems that we have as of now? And what do you think, what is the state of research as of now?
That's a very good point. We have got both problems. In the hardware, we have the error correction that, or the error itself that is preventing us from getting reliable data. Now, on the software side, you don't have the infrastructure for all the algorithms. Needs to be a lot more research that needs to happen there so that it becomes usable for different kinds of applications. One of them is definitely new drug discovery, and the other one is new kind of chemicals that you can come up with, and then prediction market. There's a lot of different applications there as well. If you look at the physics itself, physics go in different layers, right? You have Newtonian physics that has been very well understood by people, and we have engineered that to our advantage to almost the fullest. Then you go into quantum physics. There's a lot more possibilities there that hasn't come down to engineering yet. So that would be the next frontier for human race. When we understand the quantum level of physics and we engineer them to applications, that kind of things are mind-blowing. If you just look at the entanglement, you have two entangled particles that are separated by millions and millions of miles. They behave exactly the same way. Nobody knows why, but it does. How can we engineer that to our advantage? No one has ever figured that out. Those are the kind of things that are in our frontier that will come much sooner than you expect.
Thank you for your answer, sir.
Sir, my question is to all of you. Like you all guys are working on a health tech only. So, like, where do you think normal health, like our physical well-being, after 2 to 5 years down the line, using tech, like how we'll be managing our daily life, mental health, and all using tech? Because I was building something around this only, connecting to all your doctors and collaborating with your medicine and daily life schedule tracking, and then gathering all that data, then processing using an AI, then telling you that how should you continue your life further. So what's your mark on this? Like how will AI help in daily healthcare?
In the short term, AI will make it better. It's more about analyzing your data and coming up with the right solution for you. That's the short term. In the longer term, you can imagine humans, they won't be immortal. They'll be immortal. What that means is you can live as long as you want, but if you get hit by a car, you'll die. That is the future that we have in front of us. That is coming sooner or later.
Yeah, specifically, I'll talk about the research we are doing specifically for the brain, but it can be used for other parts of the body as well. So what we are developing are electronic chips that can basically travel through the bloodstream. They have the capability of autonomously recognize a target region in the brain and can even cross blood-brain barrier and self-implant there. From there, it can provide very precise electrical stimulation, and this can be used to treat diseases which are even resistant to drugs. Drugs are basically like chemicals you shove into the body. It cannot be controlled precisely, but our body is actually a bioelectrical machine. Cells in our body communicate with each other through bioelectrical signals. And if you can precisely control these bioelectrical signals, it is possible to treat diseases where drugs have been known to be ineffective. So this is one of the areas we are working on. We have results in brain cancer, Alzheimer's, as well as chronic pain. And what we have developed, as I mentioned, this implant is completely surgery-free. So you do not need to create a hole in the skull and to put the electronic chips in. If you know the Neuralink device, what Elon Musk is pursuing, that requires creating a 1-inch hole in the skull and putting the electronic chip in. But what you have developed is electronic chips which can travel through your body fluids. Brain is what you are working on, but it can also be used for other parts of the body. For example, a surgery-free pacemaker. This can be used for continuous health monitoring because electronic chips that can travel through the bloodstream can go to each and every nook and cranny of the body to figure out a source of the disease and can send signals to an external device for monitoring. So what I always say, so also I should say, like, my background is in nanoelectronics and applied physics, and then from there I had done a steep transition to the field of biology and neuroscience. And in my own lab at MIT, I fused these fields together. And I see biology is great, but biology has its own limitation. On the other hand, we have these electronic devices, nanoelectronics, quantum technology, for example. These devices, these electronic chips can be built from scratch and according to an engineer's dream to incorporate functionalities which are beyond the capabilities of biology. And you fuse these two together and you can do amazing things. So human beings do not have to be limited by the limitations of biology, and that is what is coming up in future. So the idea would be fusion of synthetic electronics with biology to transcend humans beyond their biological limitations. Thank you.
Thank you for the answer, but I have a cross question about this. This is quite childish question because like if we have so much tech, if we are moving this much advanced in the tech, in the healthcare system, like I used to think, why can't we replace the human body, like organ, if our heart is not working properly, just replace the heart and we can just live more longer, just replace the liver or any other part. So is it possible in the future with the tech or not?
Oh, it's absolutely possible, but we are not there yet. The reason we are not seeing this technology itself because that requires solving many more challenges. The non-surgical brain implant I was talking about, this is just a paper we published 2 years ago. This was last 7 years of our research at MIT. We had to solve multiple challenges, how to make these electronic chips so small that the body's immune system does not react to it, is biocompatible, safe, how to make it autonomously recognize a target region in the brain, how to cross blood-brain barrier. These were extremely hard challenges. Took us 7 years to solve that. We have done animal studies on this now, and recently I also launched a company called Kahira Technologies, and the idea is to take this translation to human. So these are really, really long processes, many more challenges we have to still solve till we can see this technology in humans. So possible, yes. Are we there yet? Are we there now? Not yet.
Okay, but still we are replacing pills with like this implant.
2 questions each, please.
Pills, we are
Otherwise,
replacing
others
pills
won't
with...
Make it one question. Honestly, make it one.
Otherwise, others won't
Yeah,
get
I
the
think the
chance.
bioelectronic devices can do much more than what pills and drugs can do. It's much more precise, much more controllable, has many more functionalities which mere chemicals cannot do. These are intelligent electronic chips.
Hi, I have a question from Neil. So Neil, this is Vidhi from the Times Group. So my question to you is that where does being human end and being technology begins?
Well, it's a very personal question. Each person will define themselves in different ways, but in my case, the definition of human doesn't include an antenna as an organ, and I've had an antenna as an organ for more than 20 years. So I also have senses that are not traditionally human, like sensing infrareds and ultraviolets. I can also sense the magnetic north with an implant in my knee. So the definition of human doesn't include these senses and organs. So I feel that I am human, but it doesn't fully describe me. So I identify more as a trans species because I've added senses and organs that are not traditionally human. And I'm a cyborg because the organs and senses that I have are cybernetic. So I feel cyborg, trans species, and not 100% human.
Hi, Neil. Neil, my question is to you. But why become a cyborg? How it will help humanity in assessing more artificial senses, and what's the limit here, or where are we going with this?
Because human intelligence comes from our senses. So if we have more senses, we will be able to gain new inputs of knowledge. So I think that sensing more is essential, and it's part of being alive. There's a lot of reality in this room that humans, as humans, cannot sense because our biology is limited. If we merge with technology, we can suddenly reveal reality, and we can suddenly sense things that our species has never sensed. And this will open up reality in ways that we can't even expect. So I think it's an exciting way of being alive. I wouldn't try to live longer. I would try to be more alive. So not trying to extend life, but being more alive. Adding senses will make this, and it will allow us to discover things that we've never been able to discover because we've never sensed them.
Hi, I'm Yadunandan Yadav, and I have a question for the entire panel. I'm a founder of a deepfake detection tool, and I have a question that with the increasing technology, it's getting harder to detect deepfake every day. So what's your take on their models, how to detect them, and all the fakes that are happening in the entire world?
I'm sorry, can you ask that question again?
Yeah, sure. With the increasing technology advancement in deepfake tools that are being made, it's very difficult to detect them. So what's your take on those models, their advancement? It would be very possible in this near future that we won't be able to detect if it's real or fake.
That's a real big problem right now. Deepfakes are pretty much undetectable. If you come up with some kind of algorithm to detect that, they will come up with some other algorithm to create which cannot be detected. So it's something, I believe that's something that we'll have to just live with. It has got deep implications. Right now we believe everything that we see or we have recorded as history. So when we try to learn our past, we read books and we look at pictures and whatever video that had in the past years to understand our history. If half of them becomes deep fakes, then the next generation will have a very different understanding of the history itself. That will change the complete outlook of mankind itself. I do not know the solution for that. Maybe you do, but maybe that's what your company is all about. But that's a real problem that we are facing in the society.
And I'll maybe take a little bit of a philosophical stance here where, we, as the human species, we've only had photographs even for maybe 200 years, right? Before that, everything was drawings and paint, whatever, and those were all, filled with interpretation and hyperbole and all kinds of stuff. And so in the last 150, 200 years, and then really in the last, we'll say 15 years, where we've been able to mass sort of send out photographs that are of high enough resolution that can land on our phones or land in our inboxes or in social media. And so while I feel like it is I agree that this is something we might have to just live with, I also think that we need to start thinking about how dependent we've become and how quickly we have sort of let go of our own sense of physical reality and our own sense of our physical sort of space to instead replace it with all this image and this just images, right? We swipe. We have entire social media platforms that are nothing but images, right? And we just swipe it. So that doesn't answer your question. How do we solve for it? I agree. I don't know that there is a solve for it, but I do think we are going to have to ask ourselves the question of what are we going to count as truth? What are we going to count as reality? And I think it's really, really important for those of us who've lived before there were deep fakes to make sure that we put our stamp on what historical documents look like, what historical videos look like, and we raise our voices about, no, that's actually not right. Even though it looks right, that's not right. That's not going to solve the problem, but I think we have to take a lot of responsibility for those of us who have existed before all of this, so that our kids who will never know digital images that aren't potentially deep fake, that we have something to give them for that.
Hi everyone, I am Shruti from Bennett University. Sir talked about being immortal. I wanted to ask you, one such similar theory is longevity escape velocity. So do you think it is achievable or it is more hypothetical?
Right now it is hypothetical, but I do believe that it is achievable. It is definitely achievable. The way we are developing our technology, and she might be the better person to answer that. I do feel that it is an achievable target, probably maybe in the next 50 years, maybe 100 years.
Hi Neil, I have a question from you. You mentioned that we can have multiple artificial sensors in our body. But for those sensors, we must need some energy or electricity, something. So is our body capable of generating that electricity, or there will be a time we have to charge our body or something?
Yeah, well, now cyborgs, we need to charge ourselves. So electricity is part of our diet. We need it. We need to include it every few days or every day. And there's different ways of charging yourself. But the ideal form would be like turbines in the blood vessels, so that we have continuous electricity being created with our blood circulation. And there's already some tests that would allow us to charge implants. Other ways are with kinetic energy or with heat. But yeah, the aim is that we should be able to charge ourselves. All these implants should be able to charge with body energy. There's one cyborg that uses solar energy, but it's still electricity.
Hi, my question is here. Okay, my question is to all of you. I'm currently building a startup in the mental health space, and my question comes from my experience where sometimes I've been told that I should understand my space completely from a research POV and before building an actual product, and sometimes I've been told that I should first take some external help from field experts and then build a product. Given that academia moves slow, what is your opinion on this?
So if you wait for all the information to be available to you before you start a company, you'll never start a company. So you have to take the first step, no matter what people tell you.
Taking an external help would be a better option, right?
External help, any help you can get, you should take it.
Right. And then what about those theories that you should understand what you're doing?
So you build something, you get help, build more. And then you get some feedback from whoever is going to use your product. Get more help, improve it. You keep iterating on it until you come to a point where it is commercially viable. That's when you start selling.
Got it.
Hi everyone. Here, the side. Okay. Hello. Basically, I had a question for you all, and one specifically for Neil sir as well. I'll ask the question from you all as well. You must know the non-invasiveness problem for the continuous health monitoring problem. Like for glucose, we have implants and needles. Like many companies have tried it, but they haven't been much successful in this field. So do you think there can be a breakthrough in the non-invasiveness sector in the continuous glucose monitoring sector? And one question for Mr. Neil as well. You must feel a lot of noises and interferences in your thing so how do you filter it out? Like how do you specifically want to feel the signal from that thing? Let it be a specific color or specific object. So how do you do it?
It gives me the dominant frequency in front of me, and it's up to the brain to focus or not. We are constantly sensing lots of things. Now, sense of balance, sense of hearing, sense of smell, all the senses are on, and it's the brain that learns to focus. At the beginning, it was chaotic because this new sense was dominant, but slowly the brain learned to normalize it, and then the brain learned to ignore it. And that was the point when I was able to live more of a normal life. And everyone that has added a new sense has had a similar experience. It's the brain that needs to learn to ignore the new sense. After some time, it can take months.
Good evening, panel. On your right. So I'm Arush from Bennett University. And considering the rapid boom of AI and how it is being used in every single task we want, and considering how, especially in healthcare, if we rely too much on AI, then there's just no point of having real people working. And if we don't have real people working in healthcare and we're not overriding AI decisions, how can we truly know if we can trust a model? Because considering the black box problems, the observability in AI problems, we're not able to actually figure out how it thinks what it does, why it does it. So how can we actually ever rely on AI when it comes to healthcare?
I'm hearing a lot of stress in this room. I've been listening to some of the questions go back and forth. There's a lot of concern about new technology entering our lives, and the media does exaggerate those concerns. So there are real legitimate reasons to worry about any new technology. But this one specific one that you mentioned, I didn't say it on stage. My PhD was actually in machine learning. I'm a space engineer who did machine learning. And one of the first products that we made was doing machine learning diagnostics for satellites. Okay, and we demonstrated with Google was our customer, and NASA, all the 9 yards. The truth is, nobody buys machine learning. They buy solutions. They buy products. The question is, does AI and machine learning help you in your day-to-day life? And that is the difference with that's happened. Because everybody says something happened, then all of a sudden AI is saying, well, what happened? It became useful. Somebody made a product that kicked Google's search in the nose. Now we're all using ChatGPT for our homework, for whatever, and there's real risks in terms of deep fakes, and people are talking about that, and government is regulating, and to the extreme where the Australian government literally said that teenagers, you're not allowed to use social media anymore. Did you hear about that? Outrageous, but kind of interesting, because now kids going outside and playing ball and getting to know each other again as humans. It's good and it's bad. You find machine learning and you make it useful and trustful to you, and you have to determine whether you trust the tool or not, and you as an individual, as a consumer, make this decision, okay? In the satellite world, diagnostics always needs a human being in the loop. And you always need to know where your model is accurate and where the machine is inaccurate. And as someone who produces that, we make sure that the operator knows when the accuracy has gone down a bit. And that's what any sort of a system, I mean, health, of course, has some very long-term clinical trial. You talk about the research out here, but it's long-term kind of relationship past the research stage where finally it gets into a consumer's hand, which means all the exciting stuff you're hearing here is hard for you to get to until it's gone through those checks. And even then, there are going to be problems, okay? So you as a consumer have to decide on your own relationship with machine learning. That's the end. Thanks. That was a great question.
Thank you.
Do we have room for more questions?
Yeah, I want to ask one.
We'll just take 2 more questions.
Okay. Hello, everybody. My name is Siddharth, and I am a journalist at Times Network. My question is for Neil. The other day, I was casually chatting with ChatGPT, and I was deliberately asking some jingoistically charged questions to it related to geopolitics. And it was very rational, very balanced in its answers. No matter how much I tried to provoke it, it did not turn jingoist. So my question to you is, after you became a cyborg, are you a more rational person, or are you a more emotional person? Your answer will depend, or will define how public discourse is going to shape once this model has been replicated in future.
I think individual cases are not to be generalized, and in my case, becoming a cyborg was for sensing more, and I feel more connected to nature, and I feel more. I'm more conscious of my senses. In life, you can decide if you want to focus on intelligence or in sensing or in both. I decided in sensing, but I guess if you merge with AI, the consequences can be very different. It depends what you merge with, what type of a cyborg you want to become. The reactions can be different, and also each brain can react differently because all brains are different. So it's difficult to generalize. The future will be not one, there will be many futures, and there will be many realities and many different types of species coexisting at the same time. So the future will be very much more diverse than we, I think, expect.
One more question, please.
So I have a question to all of you. If AI is dominant decision making in capital market and risk analysis, investment markets, so does the financial power shift from those who owns the money to those who controls the intelligence?
I think that's what you're hearing from a lot of leaders is now I think the traditional model of have a lot of financial backing, then that is what is going to translate into innovation progress. That I think is now going to be thrown into question for many models. There are things like like space going like that requires a really deep pool of resource. But when you're talking about something like healthcare, when you're talking about making like brand new, never before made chips at a reasonable cost, or at least at a reasonable development cycle, then you're really looking for intelligence, and intelligence is what's going to then orchestrate what happens next. And by intelligence, I don't mean artificial intelligence. I mean collaborative human intelligence. But that, in those, there could be a team of 5 that can build something that a team of 500 with 10x, 100x the backing could not be able to do, simply for the systems that the two are in. And so while money is always going to be important, everybody needs capital to get started, I do not think it's going to be the gatekeeper that it has been.
I agree with most of what you said. I just want to add one little thing to it. As innovators, right? As innovators, you're always going to have the scenario where people who've got monopolistic power are going to control and own their own environment, right? And it's going to feel like this massive hill to climb. This is normal in every. If you want to make a lemonade, because we're talking about business now, innovation then business, right? A lemonade stand is going to have to fight against like the Uber lemonade owner that owns like all the food and wine supply chain down there. It's no different for space. It's no different from medical. It's the same game. We actually bootstrapped our company, which is weird. It's a little weird. The truth is, if you're an innovator and you got some products with some capability, we heard a few of you talking about it, thinking about that. You go in for it, you give it a go, you do your research, you try it out, and it's almost like a snowball. You build a little bit at a time, and you're building. Investor dollars is the way to supercharge the speed, okay? The bootstrapper approach is to maintain equity. Those are your two major paths. You get a whole lot of money, you go full throttle, you go fast. You all that money, you got to hire some of these researchers you see on this stage. Okay, if you're a bootstrap and you think I'm going to do it all by myself, I'm going to be a Jedi like my father. Okay, no, I've seen it. You know, then it's a slower, steadier process. Okay, and that's just your decision to kind of go the way you want to go. The advantage of bootstrapping is you keep your equity. The advantage of raising your money is you go for speed. If you don't have that equity, there are ways you can compete with big primes. And I would look up a book on guerrilla marketing. That's what I recommend.
For the growth.
What's that?
If I go bootstrap, it trades me for the growth, because my growth hampers if I'm using all my money.
Oh, well, it's always based on your own talent anyways. It's the question of whether you got the talent to raise the investment or you got the talent to build the product. Okay, you know yourself. Thank you.
Thank you, audience. Thank you, all the panelists. It was an interesting session because of the audience. I request all the panelists to come in the front and have a group picture.